Dr. Manolis Kallistratos, the association of midday nap occurrence and duration and blood pressure levels in patients with high blood pressure.
So, dear Chairman, dear colleagues, ladies and gentlemen, we already know that lifestyle changes represents the cornerstone of treatment of arterial hypertension. And when we are talking to lifestyle changes, we are referring, of course, to physical activity, smoking cessation, weight loss, and of course to salt and alcohol reduction. However, we know that several subjects, and especially the elders, have the habit to sleep during midday. They think that it's beneficial. They don't know why. And actually, there are a few studies assessing this issue. We do know that in one study, they proved that midday sleep in healthy subjects can decrease the relative risk of coronary death for about 12%. So the real question here regarding midday sleep is it only a custom, it's a habit, or it's also beneficial? For this reason, we thought to investigate the effect of midday sleep on blood pressure levels in patients with arterial hypertension, and we prospectively studied 386 hypertensive patients, 200 males and 186 females, and in all patients, midday sleep time, the office blood pressure, the 24 hours ambulatory blood pressure measurement, the pulse wave velocity, and of course, a full echocardiographic assessment was performed. Here we have the clinical characteristics of those patients. We can see that approximately half of them were males, aged 61 years old. They were overweight with a blood pressure level very, very well controlled. 57% of those patients had also dyslipidemia, and 27% had also diabetes mellitus. And of course, we have recorded also the lifestyle habits of those patients. So we observed that in patients that have the habit to sleep during midday, those patients presented lower pulse wave velocity levels, lower left atrium diameter, lower daytime and nighttime systolic blood pressure, and of course, lower average systolic blood pressure. And in addition, there was a trend regarding the percentage of dipping status, and there was a trend regarding those patients to take fewer medications. We saw that midday sleep decreased on average systolic blood pressure, average systolic blood pressure for about 6 millimeters of mercury. Here we have the differences between sleepers and non-sleepers during daytime and nighttime systolic blood pressure. And someone can argue that 6 millimeters of mercury, it's a small drop of blood pressure, but we have to keep in mind that reductions of blood pressure as small as 2 millimeters of mercury may decrease the relative risk of cardiovascular events by up to 10%. So these 6 millimeters of mercury have a prognostic significance. Moreover, we saw that the duration of midday sleep was highly associated with the drop of systolic blood pressure and the percentage of dipping in those patients. And more precisely, we saw that 60 minutes of midday sleep can decrease the average 24-hour systolic blood pressure by about 4 millimeters of mercury and can increase the dipping status in those patients for about 2%. And we concluded that midday sleep decrease in hypertensive patients' systolic blood pressure and may enhance the dipping status in those patients. Of course, the study had several limitations. The first limitation is that this study was an observational study. However, it's difficult to randomize patients to sleep or not to sleep. It's a difficult procedure. And moreover, another limitation was the fact that those patients happen to be very well controlled. Maybe patients with untreated hypertension or uncontrolled hypertension may have a different behavior regarding the midday sleep. They could have a more significant drop in their blood pressure. Thank you.
Okay, so your take-home message?
Midday sleep seems to be beneficial in terms of drop of systolic blood pressure and may increase the percentage of dipping status and may decrease the number of pills administered.
Any questions from the floor? Please. Yep.
Microphone.
Well, actually, this is a good question. This is an observational study. We observed that patients who slept during midday had lower blood pressure, systolic blood pressure, in confront to patients who didn't sleep during midday. And we suppose that it's the midday nap that decreases this blood pressure, because it seems that the drop in blood pressure during midday is similar to the one that we observed during the night.
Okay, yes.
Microphone, you over there.
Hi, Melissa Walton Shirley from theheart.org. Since a lot of these persons were overweight, did you look at the percentage of individuals that had sleep apnea? Because it seems that sleep apnea, if you added an extra hour of sleep during the day, might actually make their blood pressures go up instead of down.
No, we didn't search about sleep apnea, but we have adjusted our sample for body mass index, age, gender, and all the other confounders. But we didn't have a question regarding sleep apnea.
Over there.
Crystal Fenn with MedPage Today. Dr. Graham or Dr. Wanate, would you be willing to comment? Would you tell your hypertensive patients to try a nap in the middle of the day?
Well, I mean, we don't know whether it's a causal effect, and it's not a randomized controlled trial, but it would be very difficult to make it a very strong recommendation on this evidence, but it would be not an unreasonable thing that people would know about this.
Yeah, but I think in hypertensive patients is very well documented that not only sleep, but also rest, for example, after meals, can reduce the blood pressure. And in this case, is necessary sleep or rest is sufficient to can exert this effect. So I think this is a very important observation, that is rest, is sleep, probably that was defined, at least in night sleep, is the quality of the sleep that clearly is related not only with blood pressure reduction, but also, for example, with thrombogenicity of the blood.
Clotting.
Reduction. And this is important because nowadays the quality of the sleep is an important risk factor also, and you have to identify this. And in this case, is sleep or is rest? And you can get the same results with rest, midday rest, or is necessary to sleep?
Actually, the biggest drop in blood pressure, we observe it before the REM phase. So someone has to sleep in order to achieve this blood pressure reduction. Of course, with rest, we have a drop in blood pressure, but I don't think that we will have a drop of such magnitude in confront to sleep.
That is important because during the REM period, you can see an increase in sympathetic driver. And after this sympathetic driver, in the REM episodes that you can see 6 or 7 REM episodes during the sleep, during the night, after the REM, you can see a more important parasympathetic driving, and this is probably a close relation with the blood pressure pattern during the nighttime sleep. That this could be also during the day sleep, and this is a good explanation for these results, the changes in sympathetic and parasympathetic driver after the REM period of sleep.
Okay, time moves on.